Hello, dear students. I'm Dr. Ambreen and I'm your course instructor for the course of Physical Agents and Electrotherapy 1. In today's lecture, we are going to discuss about the medium frequency current. We have gone through the different topics of electrotherapy in which we have studied about different types of the current that comes under the heading of the low frequency current. We have divided our electrotherapy into three main classes on the basis of the frequency. Number one was low frequency current, and the second one was medium frequency current, and the third one was high frequency current. So low frequency current are those currents which have a frequency of 0 to 1000 hertz, and medium frequency currents are those currents which have a frequency from 1000 to 10,000 hertz, while the high frequency currents are those currents which have a frequency from more than 10,000 hertz. So according to this, we said that low frequency currents include transcutaneous electrical nerve stimulation. We have studied about Faraday type current. We have studied about diadynamic current. We have studied about sinusoidal current, and we have also studied about interrupted direct current. We have studied about medical ionization, which is actually the use of the direct current. And we have also discussed that we can also use this current for electrodiagnostic purposes. For that, we have studied about strand duration curve in the last session. That was a recent last session that I have posted in your classroom. And before that, we have studied about electromyography as well. We have studied about the pain gate theory. And pain gate theory was also very interesting and important topic because you usually come across with different patients that usually have pain and inflammation, and being a physiotherapist, we need to manage them. And in today's session, we are going to start the medium frequency current. There are also the currents that are going to reduce the pain and inflammation and going to cause relief to the patient. So let me tell you the learning objective of today's session. After the end of this session, you will be clear about that what is actually medium frequency current that is going to bring about different changes in our human body. That if we have already the low frequency current, why we need to use these medium frequency current? When we are able to solve our issues like pain, inflammation with the low frequency current, then why we need to use the medium frequency current? And this session is going to tell you about the significance of the medium frequency current, in which we are going to study about the details of interferential currents. And after this end of this session, you will be clear about the application matter and how it is going to produce different physiological effects and what are they and what are the different frequencies that we may use. So let's jump towards today's lecture, that is medium frequency current. So medium frequency currents are those currents which have a therapeutically used frequency of 1000 to 10,000 cycles per second. We say them they are medium frequency current. Medium frequency current have a frequency from 1000 to 10,000 cycles per second. And there are two main examples of the low frequency current. Number one is the Russian current. The other one is interferential current. And these currents are basically going to stimulate the deeply situated muscles and nerves. Since it is difficult to stimulate these muscles and nerves by the low frequency currents without the spread of the current. The low frequency current actually have the low frequency due to which their penetration to the tissues is less as compared to the medium frequency current, which have a slightly higher frequency as compared to the low frequency current. So being a slightly higher frequency, these currents are going to cause more deeper effect as compared to the low frequency current, as like the Faraday type current and interrupted direct current. The uses of the medium frequency current is they are being preferred for the muscle re-education. They are being used to retard the rate of the muscle atrophy, for the drainage of the edema, for the pain relief as well. Let's discuss the types of the medium frequency current. I already told you there are two types of the medium frequency current. Number one is interferential current and the other one is Russian current. Let me tell you something about the history of the medium frequency current. Medium frequency currents were actually introduced by Dr. Numek in the Vienna in early 1950s. He actually wanted to overcome the problems with the discomfort that is being caused by the low frequency currents. So while maintaining their claimed therapeutic effect, he was actually working on the low frequency current, but this whole work disappeared until the late 1960s and 1970s when the work on the pain mechanism got dominated by Malzek and Webb. And they, by the pain gate theory, showed that the pain could be decreased by stimulating the primary afferent neurons, and the whole concentration diverted towards this pain gate theory or pain gate mechanism, that how we can modulate or how we can stimulate or how we can reduce the pain. Then there was introduced these medium frequency crowns, and the working was then continued, and ultimately we found two crowns that were interferential and the other was Russian crown. So let me tell you the detail of what is interferential current. This is a very common current and it is being used in our daily practice and it gives a significant effect. So it is important to understand that what is actually interferential current and what is the principle of working of interferential current. Fine. So transcutaneous application of the two alternating medium frequency currents used to produce the low frequency currents. In this type of the current, that is interferential current, we use two currents at the same time, and these two currents are of two different intensities, and we are going to apply over the tissues. And ultimately, after the application of the two medium frequency currents that we are using in this application method, are going to penetrate through the tissues and going to give us low frequency currents. So here in this picture you can see this one is a fast, there is a frequency one. This one is one medium frequency current. This one is the other medium frequency current. In the patient, we are going to apply these two medium frequency currents via the electrodes, and these two medium frequency currents are going to ultimately interfere with each other, and they are going to give us this one effect, that is your interferential current. And this effect is actually like the low frequency current. It seems exactly and works exactly like the low frequency current, because when these two medium frequency currents that are going to be applied over the skin, they are going to penetrate and they are going to interact, and this interaction is actually called interferential or interference, and this interference is going to give you an effect that is like the low frequency current. And all the mechanism then going to be occur in the tissues is exactly like the low frequency currents. So here is again the question that comes in our mind, that why we need interferential current when we have the low frequency current. When we have Faradic, sinusoidal, diadynamic, interrupted direct current, why we need to use it? Actually, the Faradic and the sinusoidal currents are low frequency current, and our skin offers skin resistance, and due to the high impedance they are going to face, their penetration is going to be reduced. While the medium frequency current faces less impedance because they have a slightly higher frequency depending upon their nature. As this is the formula that is going to show you, Z is your impedance or mean your resistance, and F is your frequency, and C is the capacitance. Fine. So according to this formula, our resistance is inversely proportional. The resistance we are going to face is inversely proportional to the frequency. If our resistance is high, if our frequency is high, there would be less resistance. If our frequency is low, the resistance this low frequency is going to face is actually high. Our low frequency current have a low frequency, so they faces high resistance because these two things are inversely proportional to each other. While the higher frequency, that is low frequency current, that is our medium frequency current, they are going to face less resistance. According to this formula, is also going to justify that these two things have inverse relationship with each other. So resistance of the skin that is being offered with the 50 Hertz is 3200 ohms, while the resistance of the skin with the 4000 Hertz that is being faced is 40 Hertz. The next is again the principles of interferential therapy. You would be still unclear that what is the principle of the interferential therapy. The principle is when we are going to pass two medium frequency currents, this is one medium frequency and this is the other. When we are going to apply two medium frequency currents, and these medium frequency currents are of alternating type, I'm going to show you in a picture as well. And they are also of slightly out of phase. What is this out of phase? I'll demonstrate it with a diagram. When these two frequency current are going to pass through the tissues, what is going to happen? The current intersect with each other and produces, these two current intersect with each other and they produces a low frequency effect when they interact, and after interaction they are going to give their end product, and this end product is usually like the low frequency currents. You would be better able to understand when I am going to give you numerical examples related to this. And it is very necessary in case of interferential current that the placement of the electrode should be diagonal. Means you are going to apply diagonal. You are never going to apply over the area where there is a pin, which is your target side. You are going to apply around the area. You are going to apply one set of electrode in this way and the other is in this way. Means the red one is under a red one and blue one is under a blue one. I'm going to show you a few more pictures. Before that, let's understand what is interference. This is a term that is from your physics. The superimposition of the one electrical current over the other is said to be interference. There are different types of the interference, like destructive interference, constructive interference. Like constructive interference is when two sinusoidal waves are exactly in phase, or one or two or three wavelengths out of phase, the waves supplement each other and they gives us constructive waves. Like in this picture, you can see these two waves, number one wave and the other wave are exactly of the same like phase or exactly of the same symmetry. They are going to combine and they are going to give a phase that is exactly like that one. So this is going to give you the constructive interference or combined effect of these two waves. While the destructive interference is when the two waves are different by half a wavelength, they are going to cancel out the effect of each other, and this is about the destructive interference. Number three is the continuous interference, and this is the interference that is actually we are going to utilize in our interferential current. Mean when two waves are slightly out of phase, they are slightly of different nature. Like this one is starting from here, like you can see the difference, and this one is going to start a little later. I mean, there is a difference of half the wavelength. When slightly out of the phase, waves are going to combine and they are going to give you an end product of each other, and this is like this way. The two waves slightly out of phase collide. They form a single wave with a progressive increase and decreasing in amplitude. Now moving towards the working of interferential therapy. And here I am going to give you some numerical examples according to which you will be able to better understand and will be clear about interferential therapy or its working. For example, initially I told you that there are two types of medium frequency current, and this one is one medium frequency, this one is other medium frequency. For example, if I say I'm going to calibrate this medium frequency is a 4000 hertz and I'm going to fix its frequency, and the frequency of the other like state would be around 4000 or 42,000, 4250 hertz or 4000, or it can vary. In simple terms, if I say this one is 4000 hertz and this one is 41,000 hertz, fine. Both are medium frequency, 4000 and 41,000 hertz, and they are going to be of different frequency. What is going to happen is when we are going to apply it, like here in this picture, the number one is 4000, the other one is at 4150. So they have a difference of 150 hertz frequency. When these two waves are going to pass through the tissues and then they are going to interact with each other, after interaction they are going to the end product, and this end product is said to be beat frequency. This end product is said to be amplitude modulated frequency. That would be the net of these two ones. Like 4000 and 4150 hertz as the other one, they are going to interact and the net product is 150 hertz, and this 150 hertz being less than 1000. So this 150, which is the end product, which in electrotherapy will say the beat frequency or treatment frequency or amplitude modulated frequency, is the frequency that is like the low frequency current. So ultimately what is going to happen, these two medium frequency currents are going to combine or are going to interact and they are going to produce a low frequency current. So you might be thinking, why not we apply directly the low frequency current? We can't apply the low frequency current for the deeper tissues, because low frequency current have superficial area like penetration, superficial like it remains in the superficial tissues, while the medium frequency have a tendency to penetrate as they have a high frequency. So they may penetrate, and after penetration they are going to interact and they are going to give us a beat frequency that is similar to the one that is actually the low frequency. So the frequency is 150. So all the effects of this would be like the low frequency current. We have studied about the physiological effects of the low frequency current. We know the indication, we know the contraindication of all these differences in their penetration. Fine. So this is a formula how to calculate the amplitude modulated frequency. This is a net of the two frequencies, mean two medium frequency that usually is around low frequency ground. So what we can do is usually we keep 4,000 in the standard. Sometimes we keep the other over the 4100 or 3900 or 4150. We remains in the effect of 100 or 150 difference, because in the low frequency current we have studied about the effects of 100 hertz, we have studied about the effect of 70 hertz, we have studied about what is going to happen if we're going to use 5 hertz, and what is the difference of 120 50 and 110 70 50, what is their physiological effects, we know all about them. So if I want to get use 10 hertz in my deeper tissues, what I need to do is I keep my one electrode over the 4000 hertz, the other electrode over 4010. So the net product will be 10 hertz. Fine. So it depends upon my choice that what effect I want to get. So I will adjust the frequency of the second electrode over my choice according to my required effect. So let's see in this picture, the one is the 4000 hertz, the other one is 41, and the end product is 150 hertz. That is your amplitude modulated frequency. This one is your peak frequency. This one is also your treatment frequency. So in interferential therapy, the amplitude modulated frequency corresponds to the frequency that is like the low frequency currents. This is another picture to show you that how they are going to be applied diagonally. That you are going to place the red and over the in front of red in the diagonal manner, and blue in front of the blue and over the diagonal manner. And this one is your treatment area. This pink one is your treatment area. So you are going to apply all around it in a diagonal manner. You're not going to follow the vertical or horizontal manner, because in that case it is not going to be interfere. And the main principle of this interferential therapy is interference. This is another picture to show you 4041 hertz, and this one is your 100 hertz. The next is this one, that is 5000. Usually we use 4000 as a standard. We may even use 5000 or 51 hertz. So this is the next progression of the discussion over the beat frequency. I said if my one electrode or set of electrode is over 4000, the other one is over 39, then my net product, like I'm going to write here, that if my one set of electrode is over 4000 and other one is over 39, then obviously I said my net product is 100. Fine. So my net product is 100 hertz. This is my beat frequency. But if I want to get this varying amount of frequency, mean I want to vary, or I want to like make some modulation or alteration in this frequency. I want that my frequency should move from 1 to 2, 3, 4, 5, 6, 7, 9, 10, and towards 70, 60, 70, 80, 90, 100. So if I want that my frequency remains continuously swinging, that it continues to swing around this area. And if I'm saying it is going to swing. For example, if I want my beat frequency to remain swinging, so what I need to do is I will keep my other electrode over 4000 to 39 hertz. When at 4000 there was a zero difference, at 4000 like one there will be 99 hertz, and so it continues to vary 1 hertz or 2 hertz, like it continues to vary. This is another way to represent the swinging, that is sweep pattern. This is a rhythmical progression to the full range of the beat frequency. Automatically vary the effective stimulation frequency using the either preset or user set sweep ranges. Sweep and swing frequency is going to prevent the accommodation in us, because we know accommodation is a property of a nerve in which it adjusts to our intensity, and with a constant amount of the current, a constant intensity of the current, it doesn't show any response and it actually accommodate according to that. So we need to undo some variation, and we said that rectangular current is very good. Similarly here, if we say if our current is swinging or rhythmically changing, then it is going to prevent the property of accommodation. So when one carrier frequency is fixed, the other one is continuously moving back and above. It is going to give a sweep pattern, and this sweep pattern is going to prevent the accommodation. The next is about the positioning of the electrodes. 4 electrodes are usually used in 2 pairs, and each pair is indicated by coloring of the wire from the machine. And what I told you, there is a number of the debates over the other electrode placements, but here in the case of interferential, they are always placed diagonally. This is a very important thing that you must always remember, that interferential current is applied diagonally, opposite to one another. In such way, the interference factor B frequency is produced in the tissues where it is going to be applied. So here are the different scales that are available according to our requirement, that what we need to use. This is another picture to show you the current pathways, that they are going to be placed diagonal to each other. And this one is your interference area, or your target area where you want to get the effect. Moving towards the physiological effects. So let me tell you, the physiological effects depends upon the magnitude of the current, the type of the mode we are using, the frequency range we have selected, the accuracy, how we have accurately positioned the electrodes. So after all these things, what this current is going to bring about is, it is going to cause the relief of the pain. It also has to cause muscle stimulation, and also increases the blood flow, because wherever you are going to apply any current, it is going to bring about the contraction. So where would be their contraction? It is going to exert a pumping action over the blood vessels or over the lymphatic vessels. So it is going to bring about the increased blood flow, and it is also going to reduce the edema, when it is going to improve the circulation of that area if there will be accumulated fluid around extracellular spaces, or if the lymphatics are not working properly. This is going to, these medium frequency current, especially this interferential current, is going deep in the tissues and going to exert a pumping action, which is not being approachable by using the low frequency current. So its effect over the edema is more significant as compared to even Faradayism under pressure, which is considered to be very effective in low frequency currents to bring about relief in edema. And even before that, which is more significant and more good, is medium frequency current, that in this that currents are going to penetrate deeper, and they are going to bring about the effects and going to help to relieve the edema. So moving toward the first point, that is pain. Pain is usually due to number of the reason, and this is the one thing with which a patient comes to us. Pain may be due to some accumulation of the metabolites or some chemicals around that area due to poor circulation. So if we are going to improve the circulation of that area by exerting a pumping action, that local pumping effect is going to bring about the improvement in the circulation, is going to remove that waste products from that area. It is going to bring the oxygen and nutrients to that area. Similarly, there are some autonomic effects that are going to occur and going to improve the and cause the vasodilation. And about 100 hertz or 80 to 100 hertz rhythmic frequency is going to stimulate the large diameter fibers. If a large diameter traffic is going to be stimulated, and actually this one is more dominating over the small diameter traffic, and the small diameter traffic is that traffic that is actually carrying the pain signals to the brain. So what is going to happen if we stimulate the large diameter traffic by stimulating the mechanoreceptors? What is going to happen? We are going to close the pain gates, because our large diameter traffic suppresses the pain by suppressing the small diameter traffic. So stimulation of the descending pain suppression system can also be achieved if we are going to get adjust our frequency, that it is going to give you beat frequency of 10 to 25 hertz. We can also block C fibers, A delta fibers by adjusting our frequency according to our requirement. The next is about muscle stimulation. For the people who can't generate useful voluntary contraction, interferential current or therapy may prove beneficial. Like 1 to 100 hertz is commonly being used for this purpose to produce the twitches, partial tetany, or tetany contractions according to the requirement. Muscle contraction is produced with less sensory stimulation when we are using differential current. Initially, when we study the Faraday type current, we said they have effect over the sensory nerves because they are going to stimulate the low frequency is going to stimulate the sensory nerves. Fine. But here we have actually been using the interferential current that has a actually slightly higher frequency, so it has a more concentration or more focus over penetrating through the tissue. So they causes less sensory stimulation, they causes more stimulation of the motor nerves. So if I want to stimulate those areas where we want to get less sensory stimulation, we may prefer to use interferential current, like in pelvic floor muscle strengthening. We prefer to use interferential current for the pelvic floor muscle strengthening. So it is claimed that rapid return of the tone of the pelvic floor when treated with the interferential currents. The next are effects of the blood flow. Interferential currents are also going to affect the blood flow due to the effect of the suction electrodes on the tissue, effect on the muscle contraction over the circulation, and deep tissue penetration stimulates the parasympathetic nerve fibers for increased blood flow. And this is the last physiological effect, that is edema. I said interferential currents prove very beneficial in edema, even more good than Faradayism under pressure. We have studied that Faradayism under pressure is the effective method of relieving the edema. So the local muscle action combined with its local vascular changes encourages the reabsorption of the tissue fluid. So 1 to 100 hertz rhythmic frequency is very good for management of edema. So if we summarize the indication, we said that we may use in pain, we may use in swelling, we may use in motor stimulation, and even in stress incontinence by pelvic floor muscle strengthening. So these are the contraindications of medium frequency current. They're exactly like all those other currents. Mean contraindications are all those conditions in which any therapy is not or absolutely not indicated. Like we are not going to use interferential current or all other currents in case of cardiac pacemakers over the thorax and over the chest. We're not going to use interferential current in advanced cardiac diseases and hypertension. In case of thrombosis, we don't want low shock thrombus. In the case of hemorrhagic areas, we don't want to increase the bleeding in pregnancy or the abdomen, over the back, over the pelvic region, in tuberculosis, in fever, and other infections over the around the eyes, in even in the skin disorders and epiphyseal regions in the children. The next is the precautions that we need to carry when we are going to apply. Precautions are the conditions meaning in which you need to take some caution. So position the electrodes below the level of the damage or discomfort over the anterior. You need to apply carefully over the anterior chest wall in epileptic patients. We also need to apply take caution and when patient in febrile condition. Interferential therapy should be placed far away from the operating death, and made this as the concept that is present in all the last or past studies. But according to the recent researches, it is said you may use short-wave diathermy if the nearest interferential therapy is working. It is not going to interfere over it. These are the types of the electrodes you can see in the picture, like vacuum electrodes, like these ones are vacuum one, these ones are, and the other are plate electrodes. Plate electrodes are attached to the patient by means of straps to ensure a good contact and greater tolerance of the treatment, made of conductive rubber, which are comfortable and long lasting. These are smaller electrodes that are used for localized effects, but this one is more superficial, and larger plate electrodes give more comfortable and deeper effect. The next are the vacuum electrodes. They are not indicated for the treatment of the hairy people or hairy skin because they can't adhere over that area, and excellent for only those areas where there is a flat smooth, for example over the back. They are made of a vacuum unit that is plugged into the rubber suction cup connected to the machine cup capable of producing the vacuum. Wet sponges are placed in the cups and it moistens the edges of the cup for better adherence. Suction should not be constant because it can be uncomfortable and may cause bruising at the area. This is a application of how you are going to apply. Like every picture you can see they are placed diagonal, like they are also placed according to the coloration of these red. These areas that they are going to be placed diagonal. With this, I'm going to end up this session that was related to the interferential current, and in which we have studied about the working of interferential current. We have studied how they are going to produce their effect, what is the beat frequency, and what the beat frequency is going to bring about, what are the possible physiological effects, and how they are going to reduce the pain, edema, or inflammation, or cause the muscle stimulation. I've also studied about why these are more like comfortable in using the around the pelvic floor and in pelvic floor muscle strengthening. So we prefer to use them in stress incontinence. And I'm going to end this session and going to post this video in the Google Classroom. If you have any queries, let me tell in the next interactive session, or you may even email me at my email that is ambreen.iqbal@urc.edu.pk. Thank you.